Hi, and welcome to the Women Leaders in Eye Health webinar series. It is my pleasure to introduce to you all today Dr. Lisa Njim, who is going to be our co-moderator this afternoon. I'd also like to highlight that Women in Ophthalmology, SEVA Foundation, and Orbis International are the co-hosts for this session. And we are excited to be able to bring this to you live via CyberSite. Dr. Lisa Njim is a board-certified corneal surgeon at Warrenville Eye Care and LASIK, a licensed attorney, and the assistant clinical professor of ophthalmology at University of Illinois Eye and Ear Infirmary. She is the CEO of Women in Ophthalmology, has taught over 2,500 ophthalmologists in preparation for their board exams, and mentors physicians using mdnegotiation.com. Using her unique MD and JD degree, Dr. Njim also advises leading medical device and pharmaceutical companies on new innovations. She has most recently created realworldophthalmology.com to help young ophthalmologists learn how to successfully transition from training to practice. Dr. Njim, welcome and thank you for being here.
Thank you so much for having us, Claire. This has been such a tremendous effort by Orbis, SEVA, and Women in Ophthalmology working together. It's an honor to be here and to work with such prestigious organizations on such a crucial issue. I just want to take a moment and thank the planning committee. They've been putting this together for the past almost year now, and it's been an amazing feat to bring attention to gender disparities in women's eye health and look at ways that we can solve these problems globally and creatively. So from Women in Ophthalmology, the planning committee has been Dr. Sarah Wester, Dr. Erin Schreiber, and myself. From SEVA, Heidi Chase. And from Orbis, Claire Zalce Timbo, Gabby Cuyas, and the entire CyberSite team. And I will take a moment to say that we are incredibly grateful for Orbis leading the way here in bringing attention and solutions to addressing gender disparity issues in eye health and helping women leaders in the ophthalmology community be elevated across the globe. This session is part of a 4-part series, and this one today is focusing on catapulting your career, seeking out opportunities for growth. We're going to be discussing unique ways in which female eye health professionals can advance and elevate their presence in the ophthalmic community throughout different stages of their career. We have an all-star, amazing global panel here, which you're going to hear from today. The first session is catapulting your career. And here we're going to talk about highlighting the pathway to leadership for women in ophthalmology, learn how to navigate new ophthalmology territory, and learn better how to understand how to advocate for family medical leave. In the second half of the session, we're going to focus on opportunities for career growth. So what additional training or fellowships may be helpful to women ophthalmologists in early practice? How can you take your presentations to the next level to get noticed and help grow your career? And how can research help advance your career? And my co-moderator today is someone that I've grown to be close friends with, and I'm incredibly privileged to have her here as well. Dr. Nada Jabbur is from Lebanon. She's currently a full-time eye surgeon at the Clemenceau Medical Center in Beirut. She's a clinical adjunct associate professor at American University in Beirut. Previously, she did her fellowship work at Wilmer, where she worked for 10 years and had experience as a PI with excimer laser clinical trials, which is invaluable. She's the current president of the Lebanese Ophthalmology Society and continues her academic activities as part of the American Academy of Ophthalmology and lectures locally and around the world. So welcome, Nada.
Thank you, Lisa. Thank you for giving me the opportunity and the privilege to be with such a stellar group of ophthalmologists from all over the world. And today we're just going to first start with some housekeeping points. I would like all the audience to be aware about the Q&A feature that we would like you to use, because we will use those at the end of every session. We will have a discussion and we will look at your Q&As, at the questions that you will have. And again, this session is being recorded and will be made available on Cyber site to watch as desired. So please do help us by sharing your thoughts and opinions throughout the polls. We're going to start now with the first poll question, and it goes as follows. Which of the following has the greatest impact on being promoted to have a leadership role in your community? Is it networking? Is it having leadership skills, a higher education level, or the cultural acceptance of women leaders?
All right, so everybody go ahead and vote in the poll. We will close it momentarily. And this is a great opportunity. Netta, do you want to just briefly mention what are some of the, oh, we already have results. All right, we'll go straight to the results. Go ahead.
For the networking was the right answer for 44% of the voters. Leadership skills was close at 35%, education level at 13%, and cultural acceptance at 8%.
Okay.
So networking, I would be interested to see the geographic distribution of the voters as well, because I'm sure it's related to the countries and the different communities and parts of the world.
Yes, I definitely agree. We're going to kick off this international panel with, as soon as there we go, with actually one of our great leaders in ophthalmology. Dr. Tamara Fountain is professor of ophthalmology at Rush University and section chair emeritus of oculofacial plastic surgery. She maintains a private practice near her home in Chicago's North Shore. She graduated with a BA from Stanford University and obtained her MD from Harvard Medical School. After completing residency in ophthalmology at Johns Hopkins, she returned to California for fellowship in oculoplastic surgery at Doheny. She is the 2021 president of the American Academy of Ophthalmology and a past president of ASOPers, where she's received the Robert Kennedy Presidential and Orkin Stracer Leadership Awards for service to the society. We are delighted to have her here, and I would welcome her to turn on her camera. There we are. So we can have a discussion on leadership. And the pathway to leadership. Tamara, how are you? Thanks so much for joining us.
Yeah, Tamara, can you share with us what you think are the important factors that have helped you reach these important leadership roles that you've had across your career and that you continue to beat and get to higher ones? I mean, how does it start, and what are some natural things or what are some acquired features?
Thank you, Netta. You know, I get asked that question a lot, and it gives me more credit than I think I am due to think I got where I am through any kind of forethought necessarily. And I'm not even trying to have any false modesty here. I think one of my first academy opportunities was I was just asked by a departing member who I knew from medical school if I wanted to take her place on this fledgling young ophthalmologist committee. I had no idea what this was all about, but I said, sure, why not? And once I became a young ophthalmologist committee member, that opened up a whole avenue of doors for me to interface with leaders at the academy. I remember I had just moved to Chicago after fellowship. I didn't know anybody here. I needed to take a coding course because I didn't know how to code. This was back in 1996, 97, somewhere in there. And I figured out that I could take a coding course, but it would be a lot less expensive if I joined my state society. So I joined my state society and I said, well, I should go to a meeting. So I just decided to go to the first meeting I'd ever been to meet some people. And at that meeting, mostly older board members sitting around the table. We're talking about this new academy program called the Leadership Development Program. And I was actually looking at the agenda and the participants, trying to figure out which voice matched which speaker, trying to figure out who I was in the room with. And I realized all of a sudden that all the talking had stopped. And I looked up and realized everybody was looking at me because they had just asked me, would you like to be our nominee? We think this is for a younger person and you would be perfect. Would you like to be our nominee for this leadership development program? It was the first year of the whole program. And I said, sure, why not? And I got in. You know, it's hard to get in now. Luckily, I got in back then when nobody knew about it. But seriously, serendipity and just being in the room, kind of like Hamilton says, is often where it begins. And that's why I answered that polling question with networking. And networking implies some sort of intentional, transactional, goal-driven process. But for me, it's really just been a desire to be with other people, like the women on this call, the people in my state society, because I was just naturally curious, liked being around people. I don't even think I'm an extrovert. I'm actually thinking I'm an introvert as I've gotten older, but I still enjoy learning about other people, and that natural curiosity has simply opened up opportunities for me that I've just taken because I've wanted to do that. So I would say for those who are interested, just kind of like dating, if you're dating, put yourself out there. You never know what might happen. You might swipe left or right, but put yourself out there, see what's out there.
I think you hit on a number of key points and a number of great lessons for us to learn and remember. One of them was saying yes when opportunities present themselves. Can you talk about that for a minute? Because I do think that sometimes women leaders have a difficult time figuring out when to say yes. Is it the right time? What happens if I say no? You know, how to kind of handle some of those things. I mean, you said yes at the right time to do the leadership development program, and that obviously led to a lot of opportunities in the future. Maybe you could speak to that for a minute and give us your insight.
Yes, we hear that a lot, but I also think it creates a little bit of anxiety sometimes, especially in our younger members just starting out, because you know, it's such a hectic time of life. You're starting your families, you're getting your practices off the ground, you're working hard because you're paying back your loans, and it may feel overwhelming to say yes to something that is yet another thing on your calendar. And so I would just reassure you that you don't have to say yes to every opportunity that comes along, but in all likelihood, your opportunity will be there when you're able to say yes. And so don't beat yourself up too much if you can't say yes. And I've said no increasingly. Most leaders, I'm sure people who have organized this call, you get to a point where you have to limit yourself. You just don't have we are not scalable as human beings. And so there's a finite limit to how much we can give to other people and still be whole ourselves. So saying yes is great. When you can't say yes, then it's wonderful to nurture that relationship with the person and say, you know, this is not a great time for me. But you might think about, you know, if you're able to give another person's name to that person and suggest somebody else. So yeah, saying yes will definitely help you get ahead. But saying no when you need to is important for your self-preservation. And helping that person find another person will cement you. That person will love you for that suggestion and will probably circle back when they're able, and maybe you'll get a second chance.
That's good.
One question that you mentioned a bit, that you might be an extrovert, but maybe you're an introvert. What about the role of public speaking, or being good at it, or liking it, or does it get better? I mean, I think it is more important than you think. I mean, because you can get people, the audience will stay attracted and are interested to know more. And I think this is an important factor that pushes people without them knowing.
Nada, you bring up a great point. And if you look at famous leaders, they are almost always good communicators. You think about Barack Obama, you think about Winston Churchill. Now, that doesn't mean you have to be a master orator, but I do think it's helpful to have some comfort level with communication, both the written word as well as the spoken word. And, you know, all of us have seen that statistic that says people fear public speaking more than they fear death, which means that the person giving a eulogy would really rather be in the casket, I guess is what that means. I'm not sure, but it is, I mean, I still get nervous. But I think what's helped me, and I've actually taken, I've made a point of trying to make myself a better communicator over the years. I feel like one can never be, you can always improve. And it's difficult sometimes to watch recordings of yourself. I hate the sound of my voice. Increasingly, I don't like to look at myself, but these are the ways that you can improve. And so I think if you're nervous, and most of us are, if you turn it around and think, this is not the audience focused on me and how I can mess up and how I can do things that will not be taken well, but think of it as you've got a gift that you want to bring your audience. You've got something that is valuable to them because it's your words, it's your message. And your audience, for the most part, unless you're maybe press secretary at the White House, your audience is a supportive audience, and your audience wants you to do well. And so look for those faces in the audience, those people smiling at you to give you that little bit of reassurance. And it's okay to mess up. That makes you human. Don't stumble over things. Don't apologize about things. Just give your message. In the end, a talk, a lecture, a panel discussion like we're having now is really nothing more than a conversation. It's just that there are a lot more people out there you're talking to who aren't always going to be able to talk to you at the same time. But nonetheless, it's a conversation. So I do think it's helpful. And for those who are still not feeling comfortable, again, just recognize you don't have to be an orator like Barack Obama. You just have to be authentic and put yourself out there. It's okay.
I think that's great. Those are great words of advice. We've got to wrap up this conversation and get to the next one. So as Dr. Jebodhsingh pulls up her presentation, what is the one thing, if people are going to walk away from our conversation today with one pearl that you want them to remember, what would that be?
One pearl is trust your voice. We are commonly maybe the more junior people in the room, maybe the only woman in the room or one of few. You may feel like you don't have enough to contribute because you're not whatever enough, but trust that your voice is valuable. And sometimes your inexperience is exactly what makes you valuable to that group, because you haven't drunk the Kool-Aid. You have a fresh perspective, and there's a reason why you were brought there in the first place. So don't hesitate to speak up and contribute to whatever organization or group or profession that you find yourself in.
Thank you so much, Dr. Fountain. That was fantastic and very inspiring as always. And we're all better for having listened to your sage advice. So thank you for that.
It's my great pleasure to introduce Dr. Jabot Singh, who is from Barbados. She's a consultant and oculoplastic surgeon at the Queen Elizabeth Hospital, St. Michael, also an associate scientific staff at the Mount Sinai Hospital in Toronto, and a general ophthalmologist and oculoplastic surgeon. After she completed her secondary education in Barbados, she moved on to her BS degree at the University of Waterloo in Canada, followed by her MBBS at the University of the West Indies in Jamaica. So she came back to the US for her ophthalmology training in Detroit at the Henry Ford Hospital, and also did her fellowship at the University of Toronto in Canada. In 2009, she returned to Barbados and is now known as the driving force behind the International Ophthalmology Subspecialty Conference that has been going on an annual basis since 2010. So Dr. Barbados will give us her talk now.
Thank you very much for having me and for your introduction. So I'm just gonna advance my slides. Okay, so I'm gonna just go through how I got where I am, because I think my story is a little bit different to most other people on the panel. I'm a child of a Barbadian, which is from Barbados. My mom's from Barbados, she's Methodist. My dad's Trinidadian and he's Hindu. And I'm married to a Jamaican who's a Catholic. And I have American-born twin boys. So my background's quite diverse. As mentioned in my introduction, I was educated in Barbados, Canada, Jamaica, Detroit, Michigan, and then in Toronto, Canada. And I returned to Barbados in 2009 after 17 years as the first and only ASOPers octoplastic surgeon on island. Now, my master plan was always to come back to the Caribbean, whether it was Barbados or Jamaica, and just step by step, things just fell into place almost like pieces of a puzzle. And when I think about it, it was just based on certain principles that I'd learned over time and my experience in different countries. Some people may look at what I've done and think that it's quite elaborate or hard to grasp, but it really is just something that fell into place. And when I reflect on what I've done over the years, it really is based on the Hippocratic Oath, if we look at that. So I'm just gonna go through a couple things here with that. So we all took the oath, and the oath says physicians pledge to keep patients from harm and do no injustice, so do no harm. I'll remember that there's an art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say I don't know. And I think that's sometimes hard for physicians. Nor will I fail to call my colleagues when the skills of another are needed for a patient's recovery. I'll respect the privacy of my patients, and that's very important, particularly in Barbados. It's a very small country, and it's very important to respect that because for their problems are not disclosed to me, that the world shall know. So when I look back on what I've done over the years, I realized that, subconsciously, this is what it's really based on. And so when I look at what the role of a physician is, we often hear that a model physician is a triple skill player in patient care, research, and teaching. But I would submit that even this is not enough. And particularly in a third world country, we need to meet the full measure of our professional responsibility. So, physicians need use your scientific expertise and ethical training to help improve public health. We must be particularly sensitive to those in need, such as children and those that are economically and socially disadvantaged. And this is the era which we are all very conscious of, where money speaks louder than words for many. And it's very important in development and public policies that are made. So I think we have to be very conscious of money-driven medicine, basically. So aside from that, we all want to do good, but sometimes the saying goes that the flesh is willing, but the spirit is weak. So why do I think that I was so motivated to do all of these things? Because I could have come back to Barbados and just been the only oculoplastic surgeon and just move ahead and do my thing and not really be conscious of what else was out there around me or helping the public kind of thing. So for me, I was blessed to be educated in some of the top institutions in the world. However, I think that truly becoming compassionate is based on personal experience. And one thing that's truly unique about me is that as a physician and in my life, very early in my career, I had a life-changing experience, which is being a patient myself, a very critical and long-term situation, which was the birth of my 30-week, 3-pound twin sons. And there's really nothing in medical school that teaches you how to be compassionate, as if you are a patient yourself. And I would say to you that this radically changed my outlook on being a doctor. So when I returned to Barbados, I'm just going to take you through the path that I took. The first thing I did is I worked in 2 established ophthalmologist offices. I actually wanted to see if I wanted to stay here, despite the whole concept of coming out of the Caribbean. Sometimes you won't fit in, or it just wouldn't be the right fit for you. So I worked in 2 ophthalmologist offices, and then what I did is I just saved up all my money from those 2 offices, from my working for 2 years. And then I opened my own office that I rented for 8 years. And now this is 10 years, well, 11 years later, and I'm now building my own office. And I did all of this on all of the things I've done are very basic principles. I try not to have any debt. So I just do very simple plans and build on those. So I didn't have to, borrow any money or go into any debt. I just had a very simple office, and then I moved from there. 10 years later, now I'm building my own office. And I was fortunate to be educated in Jamaica, the US and Canada, and I just used a lot of things, the best practices that I learned from my mentors and all the wealth of knowledge that I was exposed to help me obviously accomplish these things. Now, during the time when I was in Barbados, when I was training, I felt that every corner that I turned, I was being taught something academically. And Barbados, I thought, was a prime place for academic stimulation and growth in ophthalmology. So once again, I started with a simple background, really. I said, okay, I'm gonna, based on registration fees and sponsorship, I'll start this conference, and there'll be and that will cover the expenses. And that's how I started this conference. So the conference started in 2010, and it started as a 2-day conference. And again, based on the Hippocratic Oath, I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge of mine with those who are to follow. So this conference is a regional international conference. It's been going on now for 10 years. We had our 10th, the 10th anniversary was back in 2020. And as I said, I really wanted to stimulate academics and share my knowledge with others and the knowledge of other ophthalmologists, and establish relationships and collaborations between ophthalmology in the Caribbean and internationally. I really didn't have any skills to start a conference. All it really was that I had contacts internationally, and I'd attended meetings myself during my training. So these are just some photos from the conference. And the conference, as I said, started as a 2-day conference, and then expanded 5 years later to a 3-day conference with a practical aspect to it, which was on the 3rd day. And out of that, I was able to collaborate with 3 sponsors, and we actually built the first microsurgical wet laboratory in the Caribbean. And this was used for the conferences, and as well as you can see here in the corner, we actually use it on one of the Orbis trips that came to Barbados. So, I mean, this is an exciting addition to our hospital. Now, in addition to that, I felt that there was a real need for research in the Caribbean. We have our own unique genetics, environment, diet, and although some diseases affect us similarly, there are diseases that are unique to the Caribbean. So again, based on the oath, I will prevent disease wherever I can, for prevention is preferable to cure. So this is a charity that raises funds for research grants to give to ophthalmologists doing research into diseases that affect Caribbean people, such as glaucoma, diabetes, cataracts, and pterygia. And we have 2 ways of raising funds. My sons actually started a a lemonade company to buy themselves laptops, and they donate part of the proceeds to the research foundation. And we have an annual tea party. Unfortunately, we haven't had it since 2019 because of COVID. And that is really our major fundraiser for our research. So I continue to chip away. And as I said, slow and steady wins the race in what I think is the best way to go. And if anybody has any ideas to offer to me, but what is your vision for ophthalmology in Barbados? Thank you very much.
Great. Thank you, Kim. This is a nice, amazing story. I have a question for you. Do you have a residency program in Barbados, or are most ophthalmologists trained outside and come in? How does it?
Well, recently we've had the development of a residency program. However, prior to that, most of our ophthalmologists were trained through the UK exam. So they worked in the hospital in Barbados, and then they just passed the UK exams and became ophthalmologists once they passed all 3 of their exams in the UK.
Okay. And after so many years of living abroad and coming back to Barbados, what would you say would be your most challenging aspect in being able to set up everything, practice, and in a new place, and with the givens that you had that you did not have in North America, for example?
Well, I would say to you the most challenging thing is that just as everywhere else in the world, traditionally ophthalmology was male-dominated here. And I'm a young woman who was fortunate enough to be trained in North America, where we actually only have one other ophthalmologist in Barbados who has been trained in North America. So I had to come in almost quietly and take my time and not be overbearing or anything like that. So it's really the cultural aspect of it. I would say to you that my entire career as an ophthalmologist in North America, I never felt that I was a woman. I always felt that I was selected based on my merit. But I felt like I was a woman when I came back to Barbados. I would say that to you. So that was the most challenging thing. I mean, once I was able to understand and navigate that part of my career, I mean, now I'm well established and I'm very comfortable in what I'm doing.
Any regrets in coming back, or is it more of a positive experience in building for the future?
I would say that it's a fantastically positive experience. The lifestyle here is very, very different to living in North America. It's far more laid back. I can set my practice up how I want. I can work when I want, the hours I want, that kind of thing. But I would say my one regret is that because I trained in the US, I did general ophthalmology first and then oculoplastics, and most oculoplastic surgeons in the US don't do cataract surgery. And I actually wish that I had not stopped doing cataract surgery, because I came out of residency of experienced cataract surgeon, and I just think that I would have a lot to offer based on having done the surgery, having that training in the US. So that would probably be my regret.
Thank you.
Thanks so much for sharing your story, Kim. That's incredible. All the work that you've been able to accomplish in Barbados, and quite a role model that you are now for really everyone in that community. We're going to move on to our next poll question. So if you guys can get ready to answer this. Do the laws in your country provide for paid family medical leave? Yes, no, or I'm not sure. So we gave you an out on this one. If you don't know, you can mark that one down. Do you know, Netta, is there paid family medical leave in Lebanon?
Yes. Yes.
Okay.
Yeah.
All right. We'll see the results here in a moment. Okay, so 44% of you have, this is again where the geography would be good, right? Where you have, your country has laws for paid family leave. 37% no, and 19% I'm not sure. So thank you for that. We're going to get ready for our next speaker as she loads her deck here. I'll have to stop sharing my screen. Dr. Maria Jose Montero Romero is from Mexico. She joined the Orbis Flying Eye Hospital team in January 2017 as staff ophthalmologist and was promoted to head ophthalmologist in 2018. In her current role, she oversees the ophthalmology department, including patient care, staffing, research, and training. So thank you so much for joining us.
Thank you so much for that introduction. Like the slide says, I'm going to talk today to all of you about how to advocate for family leave. And I found the poll very interesting because I don't know if everybody here knows whether or not their country has family paid leave. But out of the 195 countries in the entire world, only 8 countries do not guarantee paid family leave at this moment. Most of these countries are either low or middle income countries. But very interestingly, the 8th country that doesn't pay for family leave is among the wealthiest in the world, which is the United States. So if you're curious to see whether or not your country has paid family leave, you can actually scan this QR code here in the screen, and it will prompt you to this graphic when you can find out. Now, that was about paid family leave. But can you imagine not having your job secured after you have a baby or you adopt a child? Well, that was the case in the United States until 1993, where they passed the Family and Medical Leave Act. You did not have your job guaranteed if you took a leave of absence there. So until that year, you were not sure whether you could come back to your job or not. And this act guarantees you that you're protected for only 12 weeks of family leave, unpaid family leave. And that is, of course, below the 16-week minimum recommended by the World Health Organization. Now, this act is very, very big. They have a lot of requirements, such as the company must have at least 50 employees, the employee must have worked with the company for at least a year and prove that they have worked for around or more than 1,200 hours in that year. And if you happen to be in the top 10% of the company, then you can be excluded. So as a result of all these stringent parameters, only 60% of the workforce is covered for this unpaid family leave in the United States. Now, after this, you can also be asked by your employer to use your unused sick time, vacation time, or personal time. So whether you want to or not, your employer may ask you to use this time during your 12 weeks. Again, if you want to see, if you live in the United States and you want to see whether your state covers paid family leave, because there are now some states in the United States that have realized the year that we live in and now are paying during family leave. So if you want to find out whether or not your state will pay for your family leave, again, you can use this QR code right here on the screen. Now let me talk to you a little bit about my experience. I joined Orbis in 2017, and I work in the Flying Eye Hospital. That is my department, that is my office. I don't work for a country office, I work for the Flying Eye Hospital department. So when in 2018, I found out that I was pregnant, to my surprise, I found out all that I talked to before, that the US do not pay for family leave. You only get 12 weeks of unpaid leave. And then in Mexico, where I actually live, you get at least 12 weeks of 100% paid leave. So then I was faced with this gray area. I was like, okay, I live in Mexico, but I work for the Flying Eye Hospital. So what is going to happen to me now? And this is where I want to speak to you some words of advice. First of all, seek out a mom mentor. I was fortunate enough to have 2 colleagues in a New York office that just recently had their babies. So I talked to them because they live in New York and the headquarters are in New York. So they got paid during their family leave. And then with that information, I went to HR and I talked to them. And I, like this says, I know that Orbis wants to be an example of the commitment to women. So I think that I should get the same benefits as my colleagues in the New York office. So I talked to them, and together we came to the conclusion that I work for the
most is the mobile application. In the past, I've been
So I got the same payment and the same leave as my other 2 colleagues in New York. So if you're faced with this situation, be prepared. Know your federal, state, and local rights. Make a plan whether you want to have your weeks before or after you have a baby. You definitely need more after having a baby. Inform your employer why paid leave benefits business. Kindly remind them that you are in that position because you are you, and that training someone will cost money and time. As for 12 paid weeks minimum, take notes when you negotiate, because if something doesn't sit well with you, maybe it's actually harassment. So you absolutely have to take it up to HR. And it's always valuable to share your experience. So I'm leaving here some links, like Moms Rising or the National Partnership for Women and Families. They're always looking for inspirational stories so that you can look it up and see other women's stories. And last, I want to leave you with this lovely phrase: you can't be what you can't see. So thank you very much.
Thank you so much, Maria, for that talk and that insight. I think you brought up several key points for people to think about. One question that came up in the Q&A, and I know maybe it's referred to different things in different countries, but by family medical leave, are you referring to maternity leave, or are there other things that people should be thinking about?
In the United States, family leave covers everything, whether you're taking care of a child or you're having a child or adopting a child. So it's so broad, and that's why there are so many gray areas in that act.
Okay, yeah, that's great. Thank you. I would invite our panelists from the first session, if they're able to, turn on their cameras now. So Kim and Tamara, I know, is juggling being, I think, 3 places at once. And you can go ahead and unmute yourself and take questions from the audience. If you guys want to go ahead and submit questions, and we also have, we'll have some discussion too. So I think the first thing that I would ask, because all of you have had these incredible stories of moving into leadership positions and really creating a pathway there. What if we all know that there are bumps in the road and there are times where we don't succeed? What is something that you didn't succeed at? And then, always the follow-up question is what did you learn in your individual pathway along? Tamara, we'll start with you.
Oh yeah, see, Lisa knows how much I have failed along the way. I think one of my more famous stories is that I didn't decide to do oculoplastics until my 3rd year of residency. And if you know about oculoplastics in the States, it's something you have to apply to when you're a 2nd year. So I was already behind the 8 ball. But I decided I wanted it enough that I pulled out of the cornea match and I applied in plastics. It probably didn't help, piggybacking on Dr. Montero's talk, that I was 7 months pregnant with my 2nd child when I went on my interviews. But nonetheless, I did not match in plastics. And so my 1-year gap year turned into 2 years. I literally left residency and I was a full-time mom with no thought about or plan for how I was going to get back into the profession. It was an interesting time. For 2 years, I didn't see a single patient. I was able somehow, through a little bit of one person who knew that I needed a job networking, I was able to get a fellowship. And it's interesting, 25 years after not getting my fellowship, I was president of that same organization. And the take-home message from that is, sometimes we get rejected and sometimes we fail. And sometimes it's because we didn't have the right goods or we weren't as qualified as somebody else, but more often than not, it was simply a matter of timing or fit. And so I would encourage all of us to, dust yourselves off, pick yourself back up, and go out there again and just give it another shot. Because knowing this audience, I think you all are pretty darn qualified. So if you didn't get something, it was just one of those one-offs. So try again, because you're worth it and you still have value.
Thank you. Kim?
Well, I actually have a similar story. The first time I applied to ophthalmology, I didn't get it in the US. So I didn't match the first time I applied. And as you know, well, you'd be familiar, the match is very competitive. And particularly, I'm considered a foreign medical graduate. So, I mean, I was in, actually at that time, my husband had moved to Houston to do his master's at Rice. So I just had a year off of just having fun. I didn't have any kids. So I had 1 year off, and then I applied again the following year and I did match. But again, if you really want to do it, you just kind of have to persist and don't let the failure, daunt you, or just continue. And most of the time it works out.
I think those are inspirational words. Maria?
Well, I first entered orthopedic surgery before ophthalmology. So that's what I wanted to be before. And I got it. In Mexico, you have to do an exam. It's like matching. And I got orthopedics. And then after a month or so, I realized that that wasn't the path for me. I didn't want it. So everybody was telling me, it's like, oh, you're going to risk it. Maybe you're not going to be able to match or pass the exam again for ophthalmology, which is even harder than orthopedics. But I was sure that that wasn't my path. So I did it again and I got it. So again, just look for your path.
So that perseverance, I think, is something that rings through for all of us, that as we to keep believing in ourselves and remembering that we have to get up when things, when we fall or when we stumble, and keep moving forward.
And Lisa, you know what? I would just add that sometimes you're not going to get it, even when you try again. And sometimes you're not the most qualified. And we need to learn from those experiences as well, and to improve in those areas where we think we need improvement. So sometimes failure or rejection is a good reminder that we are still human and that we can improve, and to do those things and to take those steps to make yourself even a better candidate the next time you try.
Excellent point. And actually, we have a question from the audience that's come up with that. If Dr. Kim, could you please share what you did during that year off to improve your application and match into ophthalmology the second time around?
So I was actually in Houston. So I did some observerships at Baylor College. I did some observerships. I volunteered in the US. As Tamara said, I just think it's you're in the right place at the right time. I just don't think I was the match the year before. And then I don't think I did anything really dramatically to improve myself, but I just so happened match the second year kind of thing. And I think, I mean, just as a quick aside, one of the things, what they tell foreign graduates is that you should come up and you should rotate at the hospitals, but that could be a hit or miss as well. Because if you go to that hospital and you rotate and there's one person who you don't get along with or doesn't like you, or because I've been in the interviews for residents, and I mean, there are lots of little picky things that they may find out about you just by being there for a month. You may not match because of that reason. So it's kind of, sometimes it's good to go and rotate at the hospital where you want to work at, and sometimes it's not, because you could do one wrong thing and then you won't match kind of thing, So, yeah.
We're going to ask one more question and then wrap up this section of Q&A. And this question is for Maria. So if there's not a company policy or precedent on pumping in the workplace after returning from maternity leave, how should we negotiate for this?
Okay, if you're absolutely certain that there is not a policy, go straight to HR and talk to them and make them create a policy for you. You can be the pioneer for the company. You can be the first.
Oh, all right, great. Thank you so much to our first panel for all that incredible advice. We will hopefully bring you back at the end to do a group discussion. And we will move forward to the next section with our next poll question. Go ahead, Netta, introduce our next poll, please.
So what are the challenges to obtaining a postgraduate training fellowship opportunity? So is the challenge going to be the language barrier, the politics or geographic barrier, your exam scores, you don't know where to look, or maybe all of the above?
So I think that can differ very, I was actually surprised in our conversations before this, how different the challenges were between different countries. Netta, you had shared some things with me that I wasn't aware of in Lebanon.
Yes, actually, as we wait for the answers, in Lebanon, we have 7 residency programs. Some are Francophone, some are Anglophone, but over the past few years, I will say, especially over the last 2-3 years, we have had more difficulties in obtaining and sending our residents abroad to get a fellowship, and mainly due to politics and geographic barriers. So the answers to the poll, the language barrier was a low number, 5%, politics, geographic 23%, which is number 2, exam scores 18%, don't know where to look 20%, and all of the above was for everyone. So I think I agree that it's a bit of everything that will play a role, and especially the politics and geographic barrier. And nowadays it's going to be COVID. We could have added that as well. I have the pleasure of introducing Dr. Laura de Benito Llopis. She's the consultant eye surgeon at Moorfields Eye Hospital in the UK, where she specializes in corneal transplant, cataract lens, and laser eye surgery. She did her ophthalmology residency in Madrid and did her fellowship both in Madrid and at Moorfields Eye Hospital in London. She has been a fellow of the Royal College of Ophthalmologists, holds the certificate in laser and refractive surgery, and has been a consultant at international centers of excellence since 2005. And most recently, she was awarded a Clinical Excellence Award in recognition for her work in developing a system to track the outcomes of corneal transplant surgery.
So I'm working at Moorfields, as you've said. It's been a long journey to reach here since I started in Madrid. I started my ophthalmology training and I worked there until here. And in this journey, I've been doing observerships in New York and at the Wilson Hospital in Philadelphia and in India. And I've worked at the Singapore National Eye Centre. I did my fellowship on Morphils. I worked at St. Thomas's first in the UK and then finally at Morphils. And I've got 3 lovely daughters, as you can see in the picture. So I thought I would share some of the tips that I learned through my journey. The first thing is quite obvious, but sometimes you forget about it. The most things happen just because you know people. And this is what Tamara was mentioning before about networking. You go and talk to people. And that's how I, for example, got my observership at the Wills Eye Hospital. I went to Sadir Hanush and I had heard him talk in the meetings. I thought he looked like a very good teacher. So I asked him, can I come and see you in Philadelphia during my holidays? This was during my summer holidays. I didn't take any time off work. It was just time that I already had off. So he said, yes, sure. And he organized, and there I went. Or it was similar with Dr. Cooper-Smith in neuro-ophthalmology. That's when I was thinking of doing neuro-ophthalmology, and I had read some of his papers. And again, I wanted to learn from him. So I sent him an email, can I come and see you? And he said, yes. And there I went. So it was similar with Professor Tan for Singapore or Mr. Vasavada for India. You talk to people. Now, unfortunately, with COVID, there's not so many opportunities to face-to-face interaction, but that will come back again. And once it comes back, do not feel ashamed of going and introducing yourself to people, because that networking really helps you in your career. But I was actually surprised in that poll question when I saw that 20% of the respondents did not know where to look for a fellowship, because the web has it all. Like everything nowadays, everything's on the web. So, for example, go to PubMed. If you read, like I did with Mr. Cooper-Smith, if you read papers from an author that you really like and you really would like to go and learn from that person, just find the email on the papers. There's always the email of one of the authors, and then that author can then give you the email of the other person you want to work with. And it may not be for a fellowship, but an observership is easy to organize. So just contact them directly. For example, on the web, you'll find hospitals. You can search for hospitals, and most of them, or many of them, the ones that are teaching hospitals, will have the fellowships that they offer, or they may have a department that deals directly with observerships. For example, at Morphils, because there's so many observers, there's a department that organizes that, and you have to contact that department, and then they can organize the observership for you. Some of the times it's less kind of strict. Like when I went to Philadelphia, it was just Mr. Hanush who told me to send some documents, and then he organized the timetable for me. So go on the web. Usually you find all the information you need. And nowadays, actually, social media, everybody's on social media. So just go search the doctor that you want to learn from, and they may be able to answer your messages. Specifically, just to give you some examples of where to look. For example, in the UK, you have this website called NHS Jobs, and you can find a job there that it will be in the NHS. So if you're looking for a fellowship, you can refine your search, and you say fellowship, and you say this subspecialty, and you can refine as much as you want or as little as you want, and you can set up an email alert so that they will email you when a job that may interest you comes up. And another one that we use all the time is Bmj Careers. And the useful thing about this one is that it's not only in the NHS, but also international jobs are listed here. Not all of them, but some of them are listed here. And again, if you keep looking at the web, you'll find, for example, the American Academy. They have this global directory of training opportunities, and there are a lot. You can see here, there's like several pages of jobs being advertised. Some of them will be short. It may just be like an observership. Some of them will be a proper fellowship, but you can browse through them, especially if you come from outside the US. Some of them I found, it was very interesting. They were funded by grants that will be offered to ophthalmologists coming from developing countries. And what they aim for is to train those people from other countries so that they can then take that ophthalmology knowledge back to their countries. So I thought that was really interesting. And then once you find the fellowship you want to apply to, so how do you actually get the fellowship? Because fellowships can be really competitive. So one thing that is obvious is you need to have a good CV. And we've discussed this in as the previous colleagues have discussed, you need to have a CV that you can apply with. Otherwise, you won't even be shortlisted. But if you are shortlisted and then you have to go to your interview, always check the requirements for the medical council registration before you apply and before you go to your interview, because fulfilling them in advance of your interview will make you a stronger candidate. So for example, in England, we have, and probably in many other countries, English-speaking countries, you have to show that you can speak English to a high level. You have this IELTS exam, and you have to pass it, I think, is with a minimum of 7.5. And if you do have the exam before your interview, you'll already be in a better position than other candidates who do not have the exam. Because if the hospital, if the interviewers think you won't be able to pass the exam, if the interview, you know, if you're nervous and then suddenly your English is not fluent enough, just because you're kind of thinking of other things, then they may think, oh, she or he won't pass the exam, so it's no point appointing them because they won't be able to get registration, and then they won't be able to do the fellowship. This is an example, for example, also at Sydney Eye Hospital. You go to the website and then they tell you which fellowships are available, how to apply, and then they tell you what you need to fulfill as English requirement. And this is basic when you go to English-speaking countries. And then if you have luckily been shortlisted, please do prepare for your interview. It's amazing sometimes we see fellows come in and they have a great CV, but they have not made the effort, that last final effort to prepare for the interview. They don't know which questions are going to come up, and then they don't have the answers prepared. And it's as simple as just going and ask from previous fellows which questions may come up, because that will be probably completely different in different countries. So if you're coming to the UK, for example, very typical questions will be regarding audit, regarding your PCR rate, regarding the reasons why you apply for the fellowship, and many very important, what you're going to do with the knowledge that you're going to get during your fellowship. Because hospitals, and especially here, and especially at Moorfields, we want to know that the knowledge you're going to get, the training we're going to give you, you're going to be able to put it to good use when you go back to your country. And again, and it has just come up with the previous discussion, be perseverant. Usually nobody gets the first fellowship that they apply to. And if it is really competitive, you might not get it the first time or the second time. It took me 3 times to get my fellowship at Moorfields, 3 times. And I got it once I had finished my PhD. So when the people were asking before what you need to do to, you know, during that time once you've been rejected, what you need to do if you really want the fellowship is just to keep improving your CV. So do your research project, publish papers, do presentations in meetings, improve the number of cataracts you've done so that they can see that you're independent for cataract surgery. If you're applying for a cornea job or something which requires surgical skills, you just have to keep trying and be perseverant. Another tip is make yourself available at short notice if you can. So if your personal and professional life allows for it, because sometimes, and I speak from what happens at Moorfields, is sometimes a fellow may pull out, or a fellow may have to leave early because they've managed to get a consultant job somewhere, and then we have to fill in the position quickly. And then sometimes then the shortlisting may be not so strict, and the interview process may not be so strict. So sometimes it's easier than to get your foot in, at least for even if it's just 3 months. And then if you do a good job during those 3 months, then you have a higher opportunity of then getting a proper fellowship afterwards. And then I would also say you can ask to modify the dates if you have been offered a fellowship, if you really need to. And this is, for example, when I applied for my fellowship and I finally got it at Moorfields, on the same year, I had been offered a Sydney fellowship. And at that time, I thought I had to choose. So I chose, in the end, I decided to go to London and to do my fellowship here. But what I should have actually done is to talk to one of the hospitals and ask them to keep my place for me for the following year. Because if you're a strong candidate, and by the time I had applied for my fellowships, I already had my PhD, had lots of publications, had done lots of surgery. So I was a strong candidate for them. So I should have asked them, please, this has happened. I would like to do both. I'm going to do one first if you can keep my offer for the next year. And these things can happen. And Moorfields sometimes, if, or for example, I'm thinking of somebody then getting pregnant, as we were talking before. If you're a strong candidate, we would like to have you once you're back from your maternity leave. So do play, as Maria was saying before, if you need to ask for your company or to give you leave because you're having a baby, just go and fight for yourself. Nobody's going to do it for you. So do play your, if you have a strong CV, you're a strong candidate, hospitals will be able to accommodate. And then think of other countries. There's a lot, obviously, of obsession about doing fellowships at the States or here in the UK, maybe Canada, Australia, but there's excellent ophthalmology being done in other countries. So brush up your language skills, I would say. It's always useful to know the other languages, but even if you only know English, in Europe, many people speak English, and you can go and do an observership or a fellowship in these places where they do really good ophthalmology. And obviously all over the world, I'm not saying just Europe. And these links with the next tip is don't be complacent, because even if you're training in a very well-known hospital, traveling abroad will always expand your knowledge. I've been in so many places, and it's been so enriching, not just professionally, but personally. And I've done networking, and I've seen that other people do things differently and sometimes better. And I found when I came to Moorfields that the junior doctors were very obsessed with staying at Moorfields because it was Moorfields, and then they thought we have to get our fellowship here and then we'll get a job here. You have to go abroad, even if you come from, I don't know, Bascom Palmer, or you come from Wiltshire, or you come from Singapore National Eye Centre, or you come from Sydney Eye Hospital. You go to other places because you need to broaden your knowledge, you need to broaden your flexibility, your adaptability, and you have to do networking, and it's just so much fun to do all those all that traveling. So do not remain just in your one center just because you think it's the best one. And finally, and these links again with the network, the fellowships and the observerships are to learn. So do work hard, but they're also to enjoy, and they are also to make friends, and personal friends and professional relationships, because that networking and those friendships will actually last forever. And thank you for listening.
Great, thank you. Thank you very much, Laura, for all these precious pearls. And it shows that you are an international person. I think people who don't travel don't know what they're missing. That's the only thing.
No.
So, but I agree with you. I've had similar pathways, and I think this is the part that makes it more interesting. And wants you to you want to keep traveling if you have the time to do that. Actually, it becomes addictive.
Yes, it does. It does become totally addictive.
It's been hard for you guys then during the pandemic, huh? Not being able to travel.
No, it has really been hard.
Yeah. Thank you for sharing that. I think you gave some incredible insights, Laura, as Marvice gets her talk ready and being able to pull her talk up. I wanted to ask you, you have such a great varied background, and with all this different experience, is there something that you found that was most helpful in growing your career? That's part of what we've moved this section. We're focusing more on opportunities for career growth. So was there a certain aspect that helped you you feel more than others in growing your career?
I think I would say when I was finishing my training and I was beginning to be a consultant in Madrid, I think learning to publish papers and present in meetings, and then obviously doing my PhD. But my PhD involved a lot of papers. I think those skills are extremely important, because if you do want to apply to an international fellowship, if you show that, they may consider you, even if you come from a place where, like Spain, where I came from. If you do not show any of those things, you don't have those skills, it'll be very difficult to compete with very high skilled candidates from other places.
Thank you. Actually, that's excellent transition to our next talk. It's a great introduction to the next talk, because she's going to talk to us about elevating your presentation skills. And Dr. Okwen Marvice is a pediatric ophthalmologist and squint surgeon at the Abbey Eye Specialist Polyclinic in Bmj, Cameroon. She's previously worked and studied in Tanzania and completed her thesis work in collaboration with the Kilimanjaro Center for Community Ophthalmology. And I have to say that in going back to one of our previous discussions, when we're talking about networking and the importance of doing that, that's how I met Marvice. She networked, and she came up to me at a Women in Ophthalmology reception and panel discussion at the World Ophthalmology Congress, I think 3 years ago now, and 3 or 4 years ago. And she introduced herself and said that she wanted to keep in touch and look for opportunities to work together. And so that's, we've done that, and that's how we came here. So, so it really does work. And you just have to put yourself out there a little bit and identify people that, that you want to work with. So Marvice, please take it away.
Thank you very much, Lisa. Good evening, everybody. Good evening from Cameroon. I'm happy to be with you here today. At one point in time, all of us will need to stand in front of people to make a presentation. One thing we should know is that it's normal for someone to get nervous or to be anxious. But the most important thing we need to know is that it's quite easy to develop good presentation skills. There are people who are born naturally who can talk in public without learning to do that and without practicing. But some people need to practice and also need to know certain things in order to perform well. So in order to come up with a good presentation, whether in a conference that we are expected to talk, in a meeting, wherever it is, there are some components of a presentation situation that we need to know. But one thing that is the key to a successful presentation is that we keep it short and simple, and it has a short form KISS everywhere you go. Talking about the main components of a good presentation, we want to look at 4 things. We have the event or the objective. That has to do with why. Why are we there? And then we look at the audience. Who are we going to be talking to? We look at what are we going to present and where. And what do we know about what we are going to present as the presenter or speaker? So we see that in the 4 main components that we've already incorporated what some people will call as the 5 W's. Why, who, where, when, and what. So I'm just going to go through them one by one. Looking at the event itself, it has to do with the objective of the presentation situation, be it a conference or a meeting. There are certain things we need to have at the back of our mind to be good presenters. We need to set up our goal so that we have a presentation strategy. How do we want to make our presentation? Do we want to make it in a way that it will be like a drama or a question and answer session? or how do we want it to be? Are we having enough data on the subject we are going to talk about? Do we know our subject well? Knowing our subject well means that we have read around that area and we have talked to people, and we really have to be ready. The specific things we want to talk about in the presentation is what we put as a presentation plan. And as I said it before, we need to keep everything short and simple. That means that whatever you're going to say, you use a simple language. You don't give so much information so that your audience will have something to take back home. And then the last two P's, we have to practice and perform. This has to do with what we know about our presentation. Practice, you can practice, like you can practice at home with your friends, you can practice with your family, you could practice alone, and then you watch videos too. That will make it better. And then performance, it also has to do a lot with what you do when presenting. Are you looking at the audience? Are you boring? Are you making the audience attentive? Are you interesting? Are you cracking some jokes in between? So you get the audience involved. Let it not be the one that the audience will be sleeping or just wondering what you're talking about. So you have to be sure of your language too, because this takes me back to when I was in secondary school. We went to a village. Then HIV was just coming in, was just being known in the country. So my principal actually took us out to go to a village and talk about it. So when he got there, he used a word. You know, here we have a lot of languages. So he used a word. When you meet a lion, you will be terrified. At the end of the day, he left with a nickname, Papa Terrified. So we have to know the audience and know what we want them to learn. Now, when we are talking about our audience, we need the people we are going to be presenting to. Who are they? We need to know the size. Are we talking to a small group of people or to a large group of people? What age group? Are we talking to youth? If we are talking to youth, we know the kind of language that we use. What is their level of education? Are they a group of professionals? The way I'll present to ophthalmologists is not the same way I'll go to a village meeting and present, or I go maybe in a community outreach or school outreach. The approach will be different. So just to make sure that they understand. Now you need to know what the audience is expecting from you and what they already know. When you know that you'll be able to come up with a good presentation in a way that you achieve your objective at the end. And you have to watch out to, you know, the emotions of the people. Are they lukewarm people? Is it an excited crowd? There is a kind of crowd that sometimes when you're presenting, especially the young crowds, sometimes when you go to school, you just see, sometimes you hear people shouting at the background, yeah, yeah, yeah. Is it an angry crowd? Are there people that are annoyed? Are there people that are ignorant of what you're coming to say? For example, like now, going into some areas to talk about the COVID vaccine could be as dangerous as going into a war zone because they see you like someone coming to kill people. So you have to be careful and you select your words and you know how to go there. Another very important thing, we live in an inclusive society. We have to take into consideration people living with disabilities. You're talking to an audience, maybe it's in a deaf school, like sometimes you go, or you're talking to a group of deaf people. It's good to have someone who knows the sign language, who can interpret, so that they benefit from what you're doing. Because the most important thing is that the audience should be able to learn and take something home. And you're talking to blind people, you won't be saying, oh, look at the left side of the screen, look at the right side of the screen. Do you see that house? Do you see? No. You are going to sound really funny to the audience if they are blind. So we really have to be careful and know our audience. Now, when we come to the third point, the presentation itself, where and what, as I earlier said, you have to know where you are. What are you going to present? That's why we need to be very, very selective, of course, because sometimes you have so much information like we're doing now, but you have to give a summary, because if you don't summarize, the audience will not be able to understand you and they will not have anything to take home. So you don't put so many things, just summarize and make sure the most important things are given out. So you know how to do it in a way that will satisfy your audience. So you need to organize your presentation too. It's important to be chronological. You should have an introduction, of course, a body and a conclusion. In order to make the presentation very interesting, you need to have some pictures too. That makes you look interesting so that the place is not boring. And when people are not attentive, sometimes when they look at the pictures, they will really be happy and follow, because most of the time, pictures are worth 1,000 words or more. And of course, when you give a talk at the end, you should be able to summarize. You have to give the most important points that will be helpful to the audience. And then you add some questions and answers. When you do that, the audience actually participates, and that is very important for them. And the presenter, when are you presenting? You have to know when, because if you don't know when, that's also a beginning of failure, because if you're not on time, you may panic or you may become anxious, which is not so good. It could just mess up your whole day. You have to know why you're there. It's quite normal, as I said in the beginning, sometimes to be uncomfortable, especially when it's your first time of presenting in a large crowd. So it's good that we should do it more often. When we do it more often, as we say, practice makes perfect, we become almost perfect or perfect. And we shouldn't be presenting on an empty stomach. We should eat and drink and get relaxed. We practice, and then we make sure that we are confident and make sure that our audience can hear us. So we have to be loud and clear and be consistent too. We need to catch the attention of our audience. We should not be boring, as I said. We should keep an eye contact. Sometimes it's hard, like online conferences like this or meetings like this. But when presenting physically, those things are very important. So you add some humor and also relate to personal stories where you have enough time. It's very important. And you should know your subject very well and you speak with some passion, because that gives an extra confidence and makes your audience to actually know that you know what you're doing and you are out for something and you have their interest. So all that is very important. So it's very important, as I said, because at one moment in time we'll be called up. We need to know why we're there. What do we need to achieve at the end? Who our audience is. We need to know why we are there, because everything we say will have to relate to the event. Of course, as I said, we have to be relaxed, organized, and confident. We get some questions and answers. We add some humor, of course. We add some pictures. We get the audience to participate. And of course, give them a take-home message so that they will remember that presentation. That is it for today. Thank you, everyone. Have a great day.
Thank you, Dr. Marvice. I'm going to ask you, so what would you think will make a presenter confident?
In order to be confident, you have to first of all know your subject, know what you're talking about, and then you keep it short and simple. And then it's always good that you practice what you're going to present. When you practice, it gives you more confidence.
Thanks so much. Those were excellent pearls. So we'll move on to our last poll question now. How can you ensure continuous career growth? By being a leader in your local ophthalmology society, teaching residents and fellows, conducting clinical trial research, teaching courses, giving presentations at major ophthalmology meetings, or all of the above. And there are no wrong answers here. It's just really what you think is important in your community to ensuring your career growth. The poll results here, 2% conducting clinical trial research and 2% teaching courses or giving presentation. And 96% of you believed it was all of the above, which is what I would agree.
Dr. Lee, last but not least, he is the last speaker for this webinar, and he is the Bruce Fralick Professor and Chair at the Department of Ophthalmology, University of Michigan Medical School, and Director of the Kellogg Eye Center. He has published over 270 papers on glaucoma and eye care delivery in general, particularly on understanding and improving eye and healthcare. And he has been on many boards of directors of the Society of Heat Fellows, the AUPO, the American Glaucoma Society, and has served as the vice chair and chair-elect of the board of directors at the American Board of Ophthalmology. So he has been the immediate past chair of the foundation of the Association of Research in Vision and Ophthalmology, ARVO. And interestingly, also he received his law degree from Columbia in 1986, and the same year he received his medical degree from the University of Michigan. Without no further ado, Dr. Lee, the floor is yours.
Thank you so much for that very kind introduction. And I'd like to extend my congratulations to the WIO, SEVA, and Orbis for organizing such a fabulous webinar. As Dr. Gilbert mentioned in the chat room, it's really an inspiring opportunity for everyone to get together and share learned lessons. And I certainly want to also express my personal appreciation for the opportunity to be part of such a fabulous panel. And I've certainly learned a lot myself. So to try to take advantage of Dr. Okwen's great presentation, the topic today is how can research help advance our careers? And I would say that research is something that we all do in everyday work. And I'll talk about that a little bit more. But I think all of us have a purpose. We came into ophthalmology and eye care because we want to help improve people's lives and make a better future. And with that purpose, it has a personal benefit. On the right, you can see that controlling for health conditions, people who have a life purpose have a longer lifespan and a lower mortality, at least in the United States. When we think about pathways in research careers, there are jobs that are full-time in research, such as seen on the left in various formats. Industry supporters of these organizations do a lot to advance eye care and the eye health of people all over the world. There are government jobs in regulatory agencies, in various administrative and finance positions, and of course, there are jobs in academic institutions. But I would say that every one of us has an interest in research because we're always interested in trying to make things better. And that can be part of our roles at academic institutions, but I would also say, especially in private practice, and those who have the opportunity to take care of lots of patients. In terms of moving forward on this, there are lots of kinds of research for all of us to consider. It's not just the picture of someone in a laboratory with beakers and centrifuges and gene analyses, but we've heard some nice talks about clinical trials and clinical research, but there's also a lot of work on how to improve the care delivery systems that we have, as well as the underlying financing and social policies. In terms of getting funding for research, the thought process of how we think about and go through research is free. It's something that's in our heads that we can all think about. And there are resource challenges around the countries of the world in terms of the opportunities for access to PubMed or to other online resources. And there are ways that people are beginning to think about how to provide more equitable opportunities all over the world. In terms of the outputs we have, we all want to contribute to the body of knowledge. And so that can be through publications, but it's no longer just peer-reviewed papers. People have talked about the role of new media, social media, YouTube videos. I was talking to one of our faculty members. She did a great job on doing a video of how to use a slit lamp. And she said that had over 70,000 views already on YouTube. And so there are lots of things that we can do to help generate greater knowledge and a sharing of knowledge. And these things can all help us, whether it's financially, reputationally, but more importantly, in how we improve the care for all of our patients. So some take-home thoughts. One is that clinical observations and curiosity are absolutely critical. One of my mentors, David Epstein, always talked about our clinics are our laboratories whenever we see patients, because every patient has a story to tell. And so things that we can do to apply what we know, do some literature searching, and ask some really interesting questions can help advance the state of research and the state of knowledge for care. Having access to the literature is really important because there are lots of smart people all over the world. And so having an opportunity to benefit from what people have thought about and discovered already means we don't have to reinvent the wheel and that we can build on the successes of others. Another important thought is that getting together with teams will do better. And that's because we all have diverse backgrounds and thoughts that can help make the work for everyone better. You've heard already in this webinar how there are doors that open and close, and I would just add my support to the concept that doors are open. We just have to be open to looking to find out where those doors are, because the times change. And if we think about the changes in opportunities in educational classes in engineering at the STEM fields, they're significantly different now than when I went through school 30 and 40 years ago. And most importantly, as you've heard, having a network, finding some mentors, and by doing well, as everybody has talked about in this webinar, showing up, doing the work, making contributions will convert mentors into supporters who will actively support our desires to have more opportunities. And so there are various steps that we could all do in terms of asking ourselves these questions. Getting to know what the literature shows, working together with teams, showing up and perseverance. You've heard all of these themes before, and these are really important aspects for what we do. In terms of funding opportunities, we can always volunteer. I know that's not available for everyone in terms of financial situations, but there are many avenues that people can think about in terms of getting a little bit of funding support, including several of the foundations that were alluded to in the Great Fellowship talk. And as you know, the information is available on websites for all. And I'd just like to end with a couple thoughts. One is this is data courtesy of Dr. Chang, the new director of the National Eye Institute here in the United States, that talks about the applications for research grants generated by investigators for the last 5 years, 5 or 6 years. You can see that the proportion of grants submitted by women have been relatively constant, but that the success rates may be starting to change a little bit in a positive direction. And so to end with, by working together, we'll have better research, we'll make greater advances, and that all of us have the opportunity to do research to help advance our careers. Thank you very much.
Thanks so much for that excellent talk, Paul. We are always enriched when you're on panels and gain so much from your insight and knowledge. I think I couldn't agree more with your talk about research and the importance of doing research in practice. Can you just speak to some of our younger ophthalmologists who might be starting practice? Where do you think is the best place for them to get involved if they're interested in research?
Sure. Everybody has a local context. I think one of the great insights that all the speakers have talked about is looking at what's available locally and also leveraging technology to make connections with people all over the world. I'm sure that all the speakers on this panel, if someone who's listening were to get an email or a contact asking for questions, that every single one of us would be delighted to try to help out in whatever way possible. And so there's one of the great things about this webinar and these series of webinars is it helps foster that sense of connectedness and network opportunities for everyone. So again, my personal appreciation to you and to everyone for the chance to be with such a fabulous panel. And I think it just emphasizes the importance of creating an international network of people that can help each other out.
Couldn't agree more. With that, I'm going to invite Marvice and Laura to turn on your cameras. So we have the part 2 discussion for our panel. And while you're doing that, we've had such great questions. And as I said, keep them coming. We'll go here for about another 20 more minutes in total. And again, everything is being recorded. And so one of the questions was, Marvice, when do you give the take-home message in the presentation? Is it in the beginning? Do you try to emphasize it in the end? When is the best place for you to put that take-home message?
So I prefer to put it at the end of the presentation because that's when everybody has listened to you and knows what you were talking about. So they will give a listening ear and take the message.
Great. And Laura or anyone, but what was your vision when you chose ophthalmology as your career path?
I had no vision at all. Did you really know? Did you know what you wanted to do when you were so young? I don't think I had any vision. At that time, I just took a step at a time. So I actually hesitated to do neurology and neuro-ophthalmology. And so I was already in ophthalmology when I asked my boss, actually, I'm still not sure. I want to go to do neurology for a few months. And when I came back from neurology, and I had loved neurology, but I then started doing eye surgery and I really liked it. So then I stayed. And then for the rest of the career in ophthalmology, I think you just have to keep your eyes open. And as Tamara was saying before, you need to keep your eyes open so that when you're in the right place and then an opportunity comes up, you just jump at it and you keep working. You kind of keep doing a little bit every day so that you progress. I don't think I really did not know I was going to be a Morpheus living in England with, married here and with 3 kids. I thought I was going to be living in Spain. So life also interferes, and I met my husband here, and that's why I stayed. So sometimes you just have to take a day at a time.
Paul or Marvice, do you want to comment on that?
Oh, yes. I won't really say it was a vision that way, but while in medical school, I had interest in ophthalmology, a lot of interest, and that was my best. And I had a lot of residents and consultants who were my friends too. But after that, when I came back to Cameroon, because I actually studied in Nigeria, I worked in a hospital where I was put in the pediatric ward. I took care of children. So I had interest at one point in pediatrics. And then something just happened. I don't understand what happened. I became interested again in ophthalmology because I also got close to the chief medical director who was an ophthalmologist. He is an ophthalmologist, a retina surgeon, Dr. Kambe, who did everything for me to go into ophthalmology. That was a good one.
Great. All right. I think for the interest of time, let me go ahead and invite all the panelists to come back on if they are able to. And we'll try to get through as many of these questions that you've had from the audience as possible. And again, thank you for submitting them. The first one goes to Dr. Kim. Did you have support of your male colleagues while you were doing this and putting this all together in Barbados?
I would say overall, yes. I think that some of you know me, I'm 5'2" and I weigh 100 pounds. So
small but mighty.
So I think when I first came back, none of the ophthalmologists here actually knew me because I left it after high school. So I don't think that they knew what to expect. So I think I was almost a surprise, I would say. But I would say overall, and I said especially the older ophthalmologists, once they got to know me, and over the years, once I established myself and developed my reputation, now everything's okay, but it certainly took some work to get everyone on my side. Yeah.
Fair enough. I think actually having both men and women in the conversation when we talk about trying to resolve gender disparities is something that's so important. I think something that, we're privileged to have men and women who support us along the way, and mentors who are also men and women to really help change the conversation and get more women in leadership roles. One question from the audience, and anyone from the panel, feel free to answer. What's the best way to ask for more leadership opportunities? If after listening to this, our audience is inspired, do you have any hints or suggestions on how they should ask for more leadership opportunities? Not everyone at once.
Well, I'll go in and say, just simply ask. Raise your hand and say, I'm interested in helping out. Is there a committee where you need help? There always is. Be ready, though, to do what we might remember from internship we used to call grunt work. But you should be willing to put your dues in that way and serve in whatever capacity. Because believe me, your skill set and your efforts will always be valuable to some organization. So be assertive and advocate for yourself and say it outright. I'd like to be involved. What can I do?
Go ahead, Paul.
I would add to what Tamara said, that a lot of times if someone comes to us and says, well, I think that we have an opportunity here to do something, or as leaders, we talk about there are these opportunities that exist in our field or our institution, and say, I've been thinking about this. This is what I've learned about this from checking into things at other places or in the literature, and I'd like to propose that we do this. I can pretty well guarantee you that if someone comes to me with that, they'll get a chance to do something.
Got Maria.
I agree with Paul and Tamara, and I would also say to have initiative. Just because something doesn't exist doesn't mean that it cannot exist. So be a pioneer and be the first one to do it.
I love that. I think that's fantastic. One question actually that I wanted to ask, actually going back to your presentation, Maria, is that something that we hear a lot from women ophthalmologists is when they go on maternity leave or they've been away for a while, then they come back and they're not as confident in their skills because they've been away from the clinic, they've been away from the OR. Anyone on the panel, what are some things that you can suggest for our women ophthalmologists to help sharpen their skills or keep up their confidence when they come back? Yeah, Laura, and if you want to unmute yourself first.
Yes.
I got you.
I've been there. I've had 3 kids and I've had to come back to work every time. And here in the UK, we have the privilege of being able to have long maternity leaves if we want. And after a few months away, you think you're not going to remember how to operate. But first, let me tell you, you do remember. don't let anybody scare you. You do remember, you've done this so many times before you went on maternity leave. It's engraved in your cerebellum. It's you know how to do your whatever subspecialty it is. But the thing that did help me was to keep editing your own videos. Actually, if you have recorded your videos from before, then editing the videos it helped me remember this, how I used to do things. It's not just, you can see videos from other people, but that's very useful too. But seeing your own videos actually and editing reminds you what you need to improve, but mainly reminds you of your own movements, right? But most of all, I mean, women, I think we tend to get scared and we tend to doubt ourselves a lot more than men do. Men always think they're amazing, and we don't tend to think that. And I think we need to remember, just to, I mean, when I went back from maternity leave, every single time, I did not find that it was anything unusual that I was doing. I just went back to the operating room, and I did not notice that I had forgotten much. So it's engraved in there already. We go through such long training that it's still there.
Yeah, go ahead, Maria.
And also in my case, I was snooping around in all the meetings, and everybody kept telling me, "You're on leave, go away." But I wanted to be kept in the loop, so I asked to be CC'd in all the emails and all the meetings for the people that I manage. So at least on that side, I felt that I was still involved and I knew what was happening. So I was prepared and very much ready to go back when I had to.
Those are great. I have one more quick question. I'm going to ask everybody to give their final pearl as we wrap up, but I wanted to address this because I think it's something that's important. One of the audience members asked when they are interviewing if they get asked inappropriate questions about gender, which a lot of us unfortunately have been in that position. I know I'm not supposed to ask you this, but and then the question comes. So anyone on the panel have some advice for our younger ophthalmologists in dealing with this or answering that kind of question?
I would say just state that if they are saying, "I'm sorry to ask you this," of course, the following is something that's going to be horrible. So you say, "I'm not comfortable answering this question." And then seek out help. If you're interviewing for a job, maybe search and go straight to HR because there are policies. So you cannot be harassed.
I think that's really important. All right, we'll just go through and everybody give your final take-home message. Tamara, can you start us off, please?
You're going to ask me for another take-home message?
Oh, okay. Yeah, sorry. This is the final pearl that if they were snoozing for the last 2 hours and they're going to walk away with one thing, what should they walk away with? They fast forwarded to the end.
Okay. All right. I've already said that you should trust your voice. So if I had to choose one more take-home message, it would be to recognize opportunity when it's in front of you. And maybe a corollary of that is also to recognize the people around you who have helped get you where you are. When you find yourself in areas of leadership, you will be receiving a lot of praise and accolades along the way. But recognize that you didn't get there alone, and you'll find your most effective leaders acknowledge all the time the help from others around them that got them there, and that will serve you well as well.
I think that everybody should know their rights and just be very aware of all the regulations and all the rules are there to protect you. So always know your rights and be prepared to fight someone if they are against you or harassing you or using the fact that you're a woman as an excuse.
Great, thank you. Laura?
Hi, I say say think outside the box, as I say, sent you. Think, even if you're in a very good center, just think, look outside, look at other places, and go travel and go do as many as you can. People are obsessed with getting consultant jobs, and they don't realize once you get the consultant job, it's not so easy to move. Whereas when you're training, you can move everywhere, and then the more you move, the better, in a better position you will be for your consultant job. So just enjoy that time and use it, and travel and go learn from everybody.
Thank you. Marvice? I don't know. I know sometimes the internet is not so fantastic there. So while she comes back on, Paul, you want to jump in?
Sure, I'd say, building on the great presentations of all the panelists here, is this notion of growth comes from being uncomfortable. And so we should get uncomfortable on a regular basis, because that's where we know we're pushing our frontiers and growing and being able to make contributions that way.
Those are all excellent pearls. Thank you so much. Here they are in written format. And I really want to take this opportunity to thank all of our incredible panelists. This has been such an amazing session and really informative on all fronts. So thank you so much for sharing your knowledge to help elevate women leaders globally.
Thank you, Lisa, for giving me the opportunity to participate in this webinar. Thank you.
So thank you all so much, and take care.